my name's Kimberly. I'm going to be doing the immediate care of a newborn. We just got baby from mom. So I'm going to bring my baby over here. I'm going to set her down. We're going to turn the baby on its side to promote drainage. I'm going to suction the baby's mouth and then nose. Great. Okay. Now I got my baby in a warmer. We're going to prevent cold stress by doing this. And I'm going to try my baby and just kind of stimulate her, get her to cry a little bit. Okay. Now, I'm going to remove any wet linens at this time. Okay, now that we have done that, my baby is in a warmer. I am going to do my Apgar scoring. You're going to do this at 1 minute and 5 minutes of life. So I'm going to be assessing the baby's heart rate. It is good. It's 120. I'm going to assess the baby's muscle tone. Lift her arms up. Oh, good muscle tone. I'm going to be assessing the baby's color. She's good. She's pink. She got a little bluing in her hands and her feet. We're going to score her on a 1 on that. I'm going to assess the baby's respiratory effort. She has a good, vigorous cry. And now I'm going to be doing her reflex irritability. I'm going to flick the bottom of her foot. She grimaced. So we're going to give her a 1. Baby has scored an 8 on her Apgar score. And I'll reassess this at 5 minutes of life. Okay. So now that we've done that, I'm going to be checking the baby's umbilical cord. We're going to check it has 2 arteries and 1 vein. There's no bleeding and it's nice and clamped and looks good. Okay, now that I've done that, I'm going to check the baby's vital signs. I'm going to listen to the baby's apical. Sounds good. I'm going to check the baby's respiratory rate. I'm going to do the baby's blood pressure with the correct blood pressure cuff. I'm going to check the baby's temperature under her arm. And I'm also going to be checking her brachial and her femoral pulses. And everything looks good. Okay, now that I have done that, we are going to move on. And I'm going to assess the baby's head. So I'm just going to have her in a sitting position. I'm going to raise her up. Okay. Support her by her cheeks. All right. I'm going to be checking for any molding, which is the cone head. The baby looks good. No abnormalities on her head. And check also for the cephalohematoma. Baby looks good. And we're also going to be checking the baby's posterior and the anterior fontanelles. They are nice and soft and flat, which is how you want them. You also make sure your baby's in a sitting position to check these. Now I'm going to check the baby's back, check for any lanugo. Full-term babies usually don't have a lot of this. It's like that downy hair they have on their shoulders and back. Also going to check to see if the baby has a dimple right above her buttocks. She does not. Looks good. Now I'll lay my baby down. And we're going to do a head to toe assessment, checking her face. So we're going to check all of her fingers and toes, her extremities. Just check to see any abnormalities, any birthmarks. Everything looks good. So now that I've done that, I am going to check 3 reflexes on the baby. I'm going to do some rub her cheek, and the baby should root towards my finger with her mouth. I'm also going to be doing the palmar and the plantar grasp reflex. Baby has done that. And I'm also going to do the startle reflex, which is called Mora. I'm going to clap my hands. Baby is through both hands up in the air, which is good. Okay, now that I've done my reflexes, I'm going to pick her up. I'm going to zero out my scale, and we're going to weigh the baby. You want your baby with no clothes on when you do this. I'm going to lay her down, not leaving her. I'm going to place my hand above her just so she doesn't roll. Oh, baby weighs 6'9". Good. Okay, now I'm going to come over here. I'm going to measure the baby. You're going to make sure you want to extend their leg out and measure. Oh, she's 19 inches long. Good. Also going to measure the baby's head circumference. Check this right above the eyes or on the eyebrows. 37, which is good, head circumference. Also going to be, I'll lift her up. Check in the baby's chest circumference. Do this around the nipple line. It's 34, which is good. Okay, now we're done with our measuring. Okay, so now that we have measured and weighed our baby, everything looks good. I'm gonna get my gauze over here, and it's in sterile water. I'm gonna wipe the baby's eyes from inner to outer. Get a clean one. Do the same on the other side. Okay, and we're gonna be giving our baby a dose of erythromycin eye ointment. It's gonna put a little dab in the corner, in the lower of the conjunctival sac of the baby. You're gonna do this in both eyes, and just let mom and them know not to take it off or rub it or anything. Okay, now that we have done that, come over here. We're gonna be giving our baby a vitamin K injection, and you're gonna give this in the vastus lateralis. Okay, section up the baby's spine, clean up the alcohol pad. We've already drawn up our solution. Give my baby the injection and put a Band-Aid on that since they don't have any clotting factors. Get rid of this in sharps. Okay, now that we have done that, we are a diaper on our baby. Make sure you don't get the baby's cord. We're going to swaddle the baby. I'll swaddle her tight. Baby is ready to go back to mom, and you always want to check the baby's bracelet against mom's if baby and mom was ever to get separated, and check the prints for the baby. Alrighty, we're all done.